The thought of going through surgery without anesthesia has become unthinkable. But around a century ago, this was reality. The anesthesia machine and press clipping on ether sniffing in the Ernest Marion Davis Library are a testament to our shared humanity. Anesthesia as a whole is a way to relieve pain for other people, and shows how kindness has always been a core part of our society. Although it has come a long way, anesthesia was originally primitive, with herbs and other substances used to induce calm and help with pain. One of the earliest forms of anesthetic was opium, used by ancient doctors to provide pain relief for their patients from 500 BCE onwards. Anesthetics were often harmful to the human body, with alcohol and drugs like cocaine and opium commonly prescribed. At the time, despite their harms, these were the best and only options available. However, continued innovation has both improved the quality of anesthesia and reduced the negative effects of its use. The anesthesia machine in ether sniffing revolutionized the field at the time, with its influence shown by a press clipping on ether sniffing, featured in the Ernest Marion Davis Library in Auckland. On October 16, 1846, William Morton, an American dentist, demonstrated the effectiveness of the substance. He removed a tumor from a patient's neck after administering ether, and the patient did not feel any pain. Nitrous oxide accompanied the use of ether, and was also commonly used at the time. However, James Simpson, a Scottish obstetrician, discovered the benefits of chloroform in anesthesia. The use of ether had come to Scotland in 1846, and he started experimenting its use in obstetrics in 1847. It was far less flammable, and in 1847, British doctor John Snow developed deliveries through vaporizing anesthetic that made the consumption of these pain relievers safer. He famously administered anesthetic to Queen Victoria. Chloroform rapidly gained popularity and became a prominent method of anesthesia for decades. Up to the mid 20th century, these forms of anesthetic were the best and only options available, until injectables became prominent. This was furthered with the efforts of Irish surgeon Arthur Edward James Barker. His spinal needle is also featured in the Ernest Marion Davis Library, and he popularized this form of anesthetic in Britain. Without him, injectable anesthetic would not have been as available or known by the public. Overall, anesthetic has improved and adapted over the years, with people constantly innovating to reduce pain. These early methods have built the foundation for our anesthesia today, and over time, increasingly refined techniques have been created, reflecting a deep sense of empathy throughout our world.